So, Dr. Sabari, this is a multi-part question here, so I'll break it down a little bit. What are some of the main challenges in collecting accurate biomarker data, and how can researchers overcome these challenges? And considering the challenges that oncologists face in retrieving testing results at second-line treatment, what technological advancements or procedural changes could streamline the process and ensure timely access to biomarker testing results?
So when we talk about biomarker testing, we're generally talking about testing the tissue, as well as sometimes testing blood or plasma. And it's important that if you have a good and accurate biopsy with sufficient tissue, that then gives us the ability to select or do the correct biomarker testing. So that's first and foremost. Fine needle aspirations, small aspirations may give us insufficient tissue. Whereas if you do a core needle biopsy, whether it be percutaneous through the chest with an image or bronchoscopically through the mouth with a camera, we're able to get a large sample of tissue. This will give us the amount of tissue needed to do the correct biomarker testing. We call it next generation sequencing, we're short for NGS, where we're able to actually identify the mutations or abnormalities in your DNA. The other type of test we can do is on plasma, or we sometimes call it liquid biopsy. That's a simple blood test where a team will draw about two 10 cc blood tubes, where we're then able to sequence DNA in your blood to help identify these alterations. So having sufficient tissue or having the blood drawn, that's important. But then also having your physician and your clinician and healthcare team order the appropriate test. It's unfortunate. A lot of folks that I see in my practice have not had adequate testing done in the frontline setting. Oftentimes, clinicians will be in a rush to start systemic treatment, both because patients are symptomatic, but also because they want to get going with treatment for patients. So, stopping your physician, your team, and saying, hey, what is my mutational profile? What is my mutational status? Is an extremely important discussion to have with your clinician. So a lot of times we only see this being done in the second line setting. So having that information up front could allow you and your family members to be matched to the best possible therapy. Now, if you've started a treatment and you don't have genetic testing or molecular testing done in the front line, I would then have it done in the second line setting. So one of my activation tips here is not only know your mutation, but speak up for yourself, speak up for your loved one, make sure that the correct testing is done and that there is sufficient tissue, both for blood and tissue from the biopsy, to do the correct testing to allow us to potentially match people to the best treatments available.